Today we are talking about the drug ketamine. What is ketamine?
Was originally developed as Ketalar in 1963 by Calvin Stevens to replace PCP, originally used for veterinary purposes. In 1964, it was discovered to be mildly hallucinogenic compared to PCP with reduced psychomimetic effects. The FDA approved it in 1970. Medically, it's known as Ketalar, Ketaject, Ketadest, and esketamine, which is a highly monitored nasal spray for depression. It's predominantly injected parenterally, intravenously, or intramuscularly.
Short-acting anesthetic for use in humans and animals.
It provides what is known as dissociative anesthesia, which disrupts association pathways. It depresses the thalamoneocortical system, the reticular activating system, and the limbic system. It enhances descending inhibitory serotonin pathways, which provides its antidepressive effects at 10 times lower concentration than anesthesia. The analgesia is provided by preventing central sensitization in the dorsal horn.
Common street name, cat tranquilizer, cat Valium, Jet K, Kit Kat, Purple, Special K, Special La Coke. How is it abused?
It usually is a clear liquid or white powder. It can be
Snorted, injected, smoked, typically in marijuana or tobacco cigarettes.
Beware its use as a date rape drug. It is hallucinogenic and dissociative, with changes in sensory experiences.
It makes the user feel disconnected and not in control.
During emergent use or increased doses, there are vivid dreams known as a K-hole, which provide often terrifying out-of-body or near-death-like experiences. It can even provide coma or deep unconsciousness. The LD50 is 11.3 milligrams per kilogram. It is a significant contributor to overdoses and fatalities, especially mixed with alcohol. There is no antidote. Acute tolerance is mild, with dependence and tolerance developing with prolonged use. Withdrawal comes with psychotic features and flashbacks. Ketamine became a Schedule III drug in 1999. It has medical use, but has virtually unknown and little studied abuse liability. It is primarily water-soluble, but becomes lipid-soluble in the blood, which provides rapid bioavailability. Peak levels appear in the plasma and cerebrospinal fluid. It undergoes first-pass metabolism predominantly in the liver, and the metabolites are norketamine and 4-hydroxynorketamine. Its half-life is approximately 186 minutes. Excretion is 85% to 95% in urine via metabolites, some in the bile and feces, but it has overall a very fast clearance. Ketamine operates predominantly as a glutamate NMDA3A ionotropic receptor antagonist, which affects downstream dopamine, glutamate, and GABA neurotransmitters. It also affects acetylcholine alpha 7 as an antagonist, serotonin 3A as a potentiator, which produces fast, depolarizing responses, but it also inhibits cholinesterase and inhibits nitric oxide via nitric oxide synthase 1. It also affects the substance P receptor, the dopamine 2 receptor, the norepinephrine transporter, as well as opioid receptors delta, mu, and kappa. Side effects include decreased heart rate and breathing, lightheadedness, jerky movements and convulsions, painful or difficulty urination, or loss of bladder control, including blood in the urine. There are also allergic reactions. The blockade of NMDAs can cause neural apoptosis at 3 hours. There is unknown carcinogenicity, but definite pediatric neurotoxicity affecting fetal and infant brain development via the placenta and breast milk. Short-term use negatively impacts attention, learning, memory.
Ketamine can induce a state of sedation, feeling calm and relaxed, immobility, relief from pain, and amnesia.
Long-term use is associated with bladder and stomach pain, ulcers, kidney problems, depression, and poor memory. It is often fatal in alcoholics or during acute alcohol intoxication. There is also increased toxicity with caffeine. This makes you think of energy drink mixers at clubs. Make sure to protect those drinks.